Thank you, Mr. Speaker. Today we debate and vote on the most important piece of social legislation in decades, a massive expansion of government unparalleled in our nation's history, with the potential to bankrupt future generations by lowering the standard of living for our children and grandchildren. For the past 30 years, I haven't been a politician, but a physician treating patients and delivering babies in rural East Tennessee. And I can say without hesitation that we have in this country the highest quality of health care in the world. But I will also say that this care is too expensive for an increasing number of people. Health care should not be a partisan issue. I've never operated on a Republican or a Democrat cancer in my life. We've heard about how this is going to save money, reduce the budget deficit. 17 years ago in Tennessee, we tried a plan called TennCare. It was an idea where we were going to compete with different companies. We're going to compete and we're going to cut costs. What happened in that? Just 10 budget years later, our costs had tripled, and we've had to cut the rolls in Tennessee because the state was literally going bankrupt. And this year, for the first time, we've had to limit patients' visits to 8 doctor visits per year, and this plan will only pay $10,000. I don't care what the cost of the care is, and those costs are shifted to private insurers. Also, the physicians are not taking this because it pays them less than 60% of their costs of actually providing the care. That approach, which is pretty much the same approach we're voting on here today, failed. And I know because I'm a physician who worked in that system. Mr. Speaker, I have one question for every member of this body. If we've seen how this big government scheme doesn't work, why would you vote for it again? Well, the states know. They're already well ahead of the federal government. 37 states, including Tennessee, are now proposing legislation to opt out of the Obamacare plan should it pass. So the states get it because they can't afford it. The seniors get it because they understand $500 billion are going to be cut from this program. And let me tell you, in the next 10 years, we're going to add 35 million people to the Medicare rolls in this country when the baby boomers hit. 3 things will happen when that occurs. You'll decrease access, you'll decrease quality because you can't see your doctor, and costs will go up. So seniors get it, the doctors get it. They're going to work harder and get paid less, and there is no meaningful tort reform, and without that you cannot reduce the cost of care. The American people get this. The people of Tennessee don't want this plan. The people of the United States don't want this plan. But the politicians who vote for it are not listening. I choose to listen to the American people and vote no, and urge my colleagues to do the same. I yield back.
Gentleman yields back his time.